Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to the Mind Myself podcast. Today we're talking about homeopathy, and we are privileged to have Jonathan DeMonte here with us. Jonathan, welcome.
Thank you, Esther. It's a pleasure to be here.
Excellent. And just remind our listeners here, I know they might have checked your profile out on the Mind Myself website, but just remind us of your credentials. I know you have some homeopathy credentials and some Bowen therapy credentials.
Yeah, so I'm first trained as a homeopath, a classical homeopath since '96. And it was after I started my career as a homeopath that I learned about Bowen therapy. And that's a very lovely complement of body work that is useful when treating chronic disease. And so homeopathy was my go-to tool for treating chronic disease.
Excellent. So maybe give us a little bit of the history of homeopathy, just briefly, because obviously there's a long history, and some of the controversy. I know there are some people who just think homeopathy is quackery, which we don't hear. So maybe a little history and a little bit of the controversy.
Well, I think when you think about homeopathy, it has in recent years had a very, very negative media image. And that's been bolstered by a lot of skeptics. And I think skepticism is a very positive thing because it makes you question what is the value of this methodology. And homeopathy is a very controversial subject because in the medicines themselves, we're giving highly diluted substances that are very difficult to even measure in normal terms. That a little sugar ball is medicated with a liquid dilution of a substance is inconceivable to logical mind. How could that contain a medicine? How could that affect a healing response? And so we're very fortunate now to be developing science that can measure the medicinal levels of substance in high dilution medicines. And I think the controversy is similar to many controversies in science, that what seems an ancient art of medicine could not fit into this world of modern pharmaceutical practice. One of the difficulties is validating in science the homeopathic effect. And that's because the true homeopathic effect is found not in the treatment of disease, but in treatment of the individual's reaction to their illness. And so if you're measuring the outcome of a cholera study, treating cholera epidemics, you can measure a beneficial effect that's on par with pharmacological effects. But when you measure the individual's illness, let's take someone with Lyme disease. They have chronic arthritis, they have digestive problems, they have neurological problems, they have vision problems, sensory problems. It's a multitude of illnesses. You can't measure that in the normal scientific model of I forget the proper terms. There's so many different research models, but essentially you can't take 10 people with Lyme disease and give them one medicine because each individual with Lyme disease has a different expression of their illness. They have a different causation. They have a different history. They have a different genetic makeup. Their expressions of their illness are totally different. You cannot lump them together. Whereas in the reductive model of pharmacology, you can easily do that. You measure a titer of inflammatory markers and you give a drug and you watch that titer fluctuate. That's simple. That's not really a totality of illness. That's just one measure of illness. So homeopathic medicine doesn't treat one aspect of your illness. It treats the whole of you. So
Mm.
interestingly, if I was a medical doctor treating a Lyme patient, I'd have to give 5, 6, 7 drugs just to, keep a lid on those symptoms.
Hmm.
Fine, that's fine. But as a homeopath, I'd be looking for medicine that could address each and every one of those symptoms, plus the cause. And so it's very interesting to look at how these medicines are chosen.
And before we get into that path, just a little bit backtracking into how did homeopathy come to be? How did it evolve or emerge?
So it was developed by a very capable medical doctor named Samuel Hahnemann, an absolute brilliant mind. He was a practicing doctor and then became a researcher and teacher. And he could actually speak multiple languages. I believe it was more than 8 languages. He
Wow.
was translating medical texts, and he was trying to understand in a curiosity manner how quinine was treating scurvy, treating malaria.
Right.
And so what he did, he started taking the medicine himself. And what he developed were the symptoms of malaria. And so he started to explore this in other medicines and found that the most reliable medicines in nature at that time were the ones that produced the problem that they were treating, or produced a very close approximation of the problem they are treating, kind of like a vaccine. In fact, vaccines are homeopathic in that they stimulate the body's immune system in a very specific way. And the same thing with a herb, which at that time was called cinchona bark, and red bark from South America was used to treat the symptoms of malaria. And so he found that that was true of many substances. And not only that, he could then dilute those substances and find the very smallest doses of those substances in order to still engender a response to that drug. And so what are you doing when you're giving something homeopathically? You're stimulating the body to behave more strongly to the problem it's experiencing. So like a simplistic model of that. You're a person who has allergies in the spring. What does it feel like to have allergies? Your nose is stuffy and running, your eyes are red and itchy. Well, what happens when you are cutting onions in the kitchen and you start reacting to those onions? Not everyone does, but some people really do, the red onion in particular. What does that feel like? It feels very similar to allergies. So in homeopathy, a common remedy for seasonal allergy symptoms is red onion, Allium cepa. That's the Latin for red onion. Allium cepa can be made macerated, mixed with alcohol and water. 1 part is added of that liquid is added into 99 parts of liquid and water, alcohol and water, and that's done multiple times over. Now, we do have a really wonderful advantage in homeopathy because if a medicine stops working, you can change the strength of it. Not stronger, not weaker, just change it like the frequency on a radio. That's why you see different numbers following the name of a homeopathic medicine. You commonly see 30 CH, 200 CH. They're not weaker or stronger, they're just different.
And what is CH?
CH is a centesimal dilution, Hahnemannian, after the founder called Samuel Hahnemann. He's the first one to develop that. Yeah.
Okay.
And sometimes you see K. K means Korsakov. So there's a lot of complexity in the words and language of homeopathy, but it's really not. You just need to know it and hear it and understand what it is. But the real main simplicity of homeopathy is that you want to find a substance that matches the symptom you're trying to treat. And in homeopathy, we've got wonderful books that help sort out those details. They're called repertories. A repertory is a storehouse, a repertorium of information. And so a repertory will have the names of medicines that produce symptoms. And so you look for the symptom and then you get a list of remedies. And so a few symptoms, you get some common remedies. And you start to then look in other books, which are called materia medica. Materia medica are drug books. And so you read about the drug. Now we say drugs in homeopathy, in pharmacology, they're different. They're different. Anything could be a homeopathic medicine. Too much water is going to make you ill. Too much oxygen could make you ill. Too little oxygen definitely makes you ill.
Yes.
So these are all substances in homeopathy. And what's interesting about the substances in homeopathy is that homeopaths, by nature, like people, they wanted more. And so now there are some 57,000 medicines compared to when the originators started homeopathy. 125 remedies was really the staple. And you know what? Those 125 remedies are really enough. And I've gone from learning more and more and more and new to throwing it all back and saying, I'm going back to the originators because their information was perfect. There was no arguing, there was no inference, there was not lots of ideas. It was as it was, scientifically recorded information that is as reliable today as it was then. There's a wonderful story. A famous homeopath called Constantine Herring, an American homeopath of German origins, sent a clinical case to 33 colleagues. He got 22 replies, all with the same remedy. If you did that today, that same clinical information in a conference of homeopaths, you would receive 33 different, 100 different choices. And that's because there's just too much information. And so that forest has grown and it's wonderful. There's no question that's wonderful. And some minds are able to hold that much information. I'm not one of those. I need practical tools to help me choose the medicine. I always say that since I've gone backwards in time to using the original work of homeopaths, my success rate is, well, it's fantastic compared to what it was.
That's amazing.
I've been in practice 25 years. And so that's not by accident. People don't pay a homeopath unless you get results.
Exactly. Exactly. And I have a question about, so people have heard about homeopathy and they know, a lot of people know about the little white sugar pills, but what should somebody expect from a homeopathy appointment to say with you, whether it's online or in person? How long does it take? What kinds of things do you ask? Just briefly, what can people expect?
Mostly, I want to know what it feels like to have your illness, any medical diagnoses that have preceded the interview. I want to know medications you're taking. But when we get into the understanding of what your disease is, it's not through the lens of radiography and a diagnostic report from the pathologist. It's from the symptom expression. So if you have an arthritic knee, want to know in what way the symptom feels, where it is, where it refers, what time of day, what are the characteristics of that pain and inflammation that you experience. I want to know how it affects other things in your system. Maybe it affects your ankle or your hip. Maybe you don't sleep on one side of the bed because of it, etc. So all these little characteristic expressions of your illness are what are valuable to the homeopath. And one thing about homeopathy is it's a very limited language of information that's really useful, really reliable. So most homeopaths should spend quite a bit of time discerning from you, not the emotional story of your life, and why you're so sad or depressed or happy or broken. That's fine. That's easy, but the characteristics of your illnesses that are the added confirmation of the state you are in is not psychiatry. It's not counseling. It's not. It's information gathering. So if you're broken emotionally because you've been caregiving for your parent who's passing, well, what more do I need to know? Not that much. I need to know what you do with that. Does it affect your sleep? Does it affect your mood? Does it affect your energy? Does it affect your motivation, your spirit? That's what I would need to know, not the story of your emotional relationship, but the effects of it. So it's very different than psychology. Can't make inference accurately for the sake of homeopathy. Yeah, you can all assume a lot from that, a story like that, but you can't infer that your condition of insomnia is because of that. It's just the insomnia is what it is. I wake up at 3 a.m. every morning. That's the symptom, not the story that precedes it. That'd be normal. That's the thing. What's normal is not that useful as a homeopath because it doesn't tell you the precise character of you in the reaction to your illness, to your stress.
And about how long do you spend with a typical client or patient, say on your first visit and then subsequent visits?
For me, a first visit is usually about an hour, and that's pretty fast compared to some homeopaths. Some homeopaths, it's like 4 hours.
Wow.
That's just the way they work. They want to really go deep into finding some unique prescription. Whereas maybe there isn't just this one unique prescription for a person, but a remedy that helps free you to make better choices and make your body work better. That's really where I'm coming from, a more pragmatic position. But again, if I'm treating a skin disease, the skin has to change. If I'm treating insomnia, the sleep has to change. If I'm treating hormones, the hormones have to change, etc. There's no gray in homeopathy. There's levels of response that are somewhat positive, and you have to watch those and observe those carefully. But there's no, but for the most part, things are black and white. There's no routine, or you must take this medicine for 6 months. It's not like that. You have to have measurable outcomes. And so you have to have a good picture of the symptoms. And so that's what I'm really getting. And because I've returned to the originators of homeopathy, they saw hundreds of people a day. How did they do that? Because they were simple. They had simple questions to help define simple solutions. You can't be a practicing homeopath and see 3 people a day. That's not going to work.
Wow. So as we wrap up today, Jonathan, thank you for this wealth of information. What's one thing you would like? You're welcome. What would you like to leave somebody with who is saying, I've never tried homeopathy. I think I might want to step in because I've tried a bunch of other things that haven't worked. This sounds gentle and non-invasive and natural. What's something you'd like to leave them with?
So if you have an acute illness, that's an easy choice. You're going to find a wealth of useful treatment options using homeopathy, treatment practitioners, etc. If you're concerned about a chronic illness, then you really need to be in the hands of a well-trained, experienced practitioner. And they're not the only practitioner perhaps you should be seeing. However, they might become an integral part of your treatment. So if you're handling something like long COVID, homeopathy is a wonderful choice for that. If you're handling lupus, Lyme's disease, chronic disease, chronic fatigue syndrome, arthritis, bladder problems, homeopathy could be a very wonderful choice. Emotional issues where you have perhaps anxiety or dementia, and helping someone with dementia perhaps. Very, very useful tool. So homeopathy has a broad spectrum of effect. because it can push the body to work better. And what is the limit of that? Who knows? Who knows? We don't know. Just because modern medicine doesn't have an answer for a problem you're dealing with doesn't mean there isn't a way your body could get better, could not get better.
What a perfect way to end. Listening to your body and getting some help to nudge it in the right direction. That's awesome. Thank you, Jonathan.
Thank you. It was a lot.
Yes, it's a lot.
Hopefully.
And if you want to connect with Jonathan, his information is below. And thank you for joining us today.
Thank you, Esther.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.